Today I'm going to present the COVID-PSYC project. The main objective of the COVID-PSYC research is understanding, monitoring, perceiving, and measuring the symptoms of anxiety, depression, and post-traumatic stress disorder during the COVID-19 pandemic, assuming that the pandemic will be a great traumatic event for all of us. Therefore, we have as a purpose measuring the trajectories of the symptoms through the pandemic, understanding how many, which, and how they work during this period, investigating the main risk factors that are associated with the symptoms and disorders, focusing on the personality and other traumatic situations, and identifying the greater vulnerability risk groups. Beyond that, we seek to connect the post-traumatic trajectories to the existence of a post-traumatic growth, to find as learning and acquisition of positive experience from an event that was initially only negative. Our main hypotheses are the existence of different trajectories for people during a traumatic event, and how the symptoms and the psychopathology relate to the socio-demographic and economic factors and other traumas related or not to the COVID-19 pandemic. We also found that violent situations, the consumption of alcohol and other substances, robberies, and financial losses can aggravate the psychic symptoms in this scenario. Furthermore, we would like to observe if any traits of personality have influence in these trajectories and if the traits of negative affection have influence in a milder post-traumatic growth. Lastly, we believe that the personality traits remain stable in the majority of the people that present resilience, but not in those who present symptoms. The study has a longitudinal methodology seeking to monitor the population during this period of time, using online survey forms of ample dissemination on social network and digital media. Our coverage is national, which means that every Brazilian residing in Brazil or not that is 18 years or older can participate in the research. Patient and public involvement (PPI) means actively working in partnership with patients and members of the public to plan, manage, design, and carry out research. It is research being carried out with or by members of the public, rather than to, about, or for them. Our instruments are diverse and seek to contemplate every aspect of this study. Through them, we can identify the symptoms in the subgroups and the primary and secondary outcomes, the last being the burnout in healthcare professionals, the stress in university students, the substance consumption, and the post-traumatic growth. The first phase of the survey was applied from April 22nd to May 8th. Meaning it started 45 days after the Ministry of Health declared the existence of community transmission of the virus and 60 days after the first case of COVID-19 in Brazil. The next survey forms will include other subjects, such as a list of traumatic events that is useful for us to evaluate if the trauma was caused by COVID-19 or other events that may have occurred during the pandemic. A questionnaire about physical activity, burnout among healthcare professionals, questions about sexuality, disabilities, prejudice, among others. Every phase of the study includes information about trauma related to the pandemic, substance use, sleep quality, stress, depression, anxiety, post-traumatic stress, and alcohol consumption. The sample profile is very specific. 75% are women, 8% are from middle and upper class, 85% are white, and almost 90% have high school or undergraduate education level. The sample is majorly from the south of Brazil, being that 1/3 of them is from Santa Maria, where our university is located. Therefore, we can note that our sample profile is different from the majority of the Brazilian population, which precludes us to extrapolate our results on a national level. That means that our acquired results are only valid for the specific population represented in the study. Our research branches are university students, analysis and study of the psychological impacts and factors associated with the COVID-19 pandemic, and university students focusing on depression, anxiety, stress, and PTSD, as well as the perception of the students of the university itself. Healthcare professionals, the study observes the evolution of the symptomatology in professionals of the health field in relation to diagnosis of depression, anxiety, stress, and also seeks to identify risk factors and potential socio-demographic protection factors, as well as correlating the unadapted personality traits. Adverse situations. The focus is on experience of violent situations that provoke a trauma or modify the psychological behavior. We are working on an article about women who are victims of domestic violence, in which can be observed PTSD symptoms. We also associated with alcohol abuse, depression, and anxiety indicators. From the data collected by the COVID-psych research, can be identified a recrudescence in the depression and anxiety symptomatology in a big group of people. Hence, the team saw itself with the task of developing measures focused in helping, even indirectly, those people. So, in the extension branch, the team executes psychoeducative, assistential, and educational measures, being the first one based on lives, webinars, meetings, and roundtables, and publicize in social networks audiovisual materials about subjects related to the challenge of mental health in the pandemic context. The assistential measures present itself as participant support service, in which a participant, after getting in contact with the researchers looking for help, will be guided. The objective of this, however, is not offering diagnosis or medical prescriptions, but spreading psychoeducation and the psychological first aid. In this scenario, the extension team also executes educational measures that consist in online teleorientation, psychoeducation, and PFA. We hope to reach mostly healthcare professionals, non-psychiatrists or psychologists, ones who dispose of techniques that can be used by physicians, nurses, social workers, etc. This branch consists in the offer of lectures, psychoeducative measures focused in the academic community, and extracurricular internships targeted for medical students. Field training, psychotherapy care, practice of teaching during service linked to the psychotherapy medical residents, optative class for the undergraduate courses in the health field, tutoring. They happen from Monday to Friday in a established time. Each semester has 4 tutors that help in the activities of the complementary disciplines, specifically in the planning of the activities and assistance in the practical activities. Elective classes involve the same topics as the courses, and the targeted group is undergraduate community. short duration course, topics related to mental health promotion, prevention, and treatment, focusing on resilience for under and postgraduate students, offered online with the objective of psychoeducation. Thus, it is concluded that the project COVID-PSYC integrates the segments of education, research, and extension in order to guarantee the interaction of the university with society. Lastly, I would like to thank you for the interest in knowing more about our research and invite everyone to contact us, visit our website, and stay informed about our next steps. We are available for any doubts, suggestions, or contact.